Hello, I am Cameo King, and welcome to another round in our Trusted Voices series. This is a production of Relaunch Greater Lansing, and our goal is to communicate accurate, timely, and science-based information about COVID vaccines in hopes of encouraging everyone to receive the vaccine in the coming weeks. Again, I am Cameo King. I've been in the Lansing area for over a decade now. I am the host of the Good Girl podcast, as well as the founder of Grit, Glam, and Guts, a nonprofit that serves teen girls. And with us today, we have Dr. Shoyinka, the medical director of the Ingham County Health Department. Thank you for taking your time with us today to talk about this topic.
Hey, Cameo, how are you?
I'm good. You and I, we've had several conversations together. You've been on the podcast, and so this will be a great conversation. So before we hop into it, where are you right now? Where are you?
I am at MSU Pavilion, which is where we have our largest mass vaccination site for the COVID-19 vaccination. So I'm sitting outside and I can see like a bunch of cars in front of me and people are getting vaccinated.
Wow. So how's it going out there? Is it running smooth? Is it like a mass herd of people? How's it going out there?
So I always say that our team, our planning team, the operation is like really smooth. It runs really well. We do the average about 1,000 vaccinations a day. Today, I think we're doing about 1,300, a little over 1,300 cases, and we're ramping up to be able to do like 1,500 on some days too. So, and it runs really well. Each car coming in probably doesn't spend more than 30 minutes in total, including the 15 minutes observation that they have to do after they get the vaccine. So right now we have like 7 lanes and each lane has like 10 people in it. And we just have them, everybody gets their vaccine in their car. They wait, we watch them for 15 minutes. As long as they don't have any reaction and we haven't really seen anything major, then we let them go and everyone seems happy.
That's really good. So right now it's about 1,000 people per day. And I know prior to this that there were only certain people who could actually get the vaccine. Can you talk about those categories?
So we've moved through like different phases. Initially, when we started in December, the state gave us like a prioritization list on how to implement and administer. And we started with, healthcare workers primarily, and then, added, eventually went to 65 and older, and then included essential workers in different categories. And each health department, each jurisdiction within some of those categories was able to kind of like prioritize based on, their population makeup and things like that. But as of Monday, March 22nd, the categories have been broadened significantly to the point where now if you are 16 and older, actually, 16 years and older with some underlying condition, you are eligible to get the vaccine in the state of Michigan overall. And as of April 5th, anyone who's 16 and older will be able to get it. So
it's right around the corner.
It's right around the corner.
Will be able to sign up and grab it. So what do you say about those, or what do you say to those who are just simply hesitant? They hear the science, they trust you, but they still have just like a hesitancy on their hearts.
The hesitancy is real. Some of it is, justified. There's a lot of stuff that has happened in the last year that has been really, really new. And, information changes so quickly that I don't blame anyone for being hesitant. The only thing I would say is that, when you have a vacuum, something is going to fill it, right? So if you don't have enough information, the best thing to do, for example, i.e. the vaccine, is to find out more information about it, right? to get an understanding of what it's made up of, what it does, what's expected, what the side effects are. And that understanding, I find, has helped people to make a better decision. So it's, at least if you make a decision after finding out all you can about it, and you still say, no, I don't want it, at least you can say you made an informed decision, right? As opposed to, no, I just heard it's not, it's this or it's that, or it's making people, grow horns or whatever it is. But, at least be informed and then think about it and then, move on from there.
And so you're talking about being informed about the vaccine. And so now there are essentially, I think, not three different vaccines, but three different manufactured is what I'll call them vaccine. We have Johnson and Johnson, we have Moderna, and I think Pfizer is the other one.
Right.
And Johnson and Johnson is one shot. In my mind, I'll get it done. And the other two are two shots. What would you say to those individuals who are, in a sense, going vaccine shopping, like to figure out, is there enough information out there to go vaccine shopping?
No. I think that, again, I think some of the things that we think about, those questions about whether I should vaccine shop, are justifiable in this landscape of so many uncertainties. But what I would say is that there's so many more details to that, to the different vaccines. So let me back up. So yes, there are three different vaccines. It's like saying there are three different soaps, bar soaps, for example. There's Dove, there's Dial, and there's, I don't know, Oil of Olay, kind of. Different manufacturers, but they do the same thing. They might even, for example, Pfizer and Moderna are a different technology from Johnson and Johnson. When we also look at, for example, there's been a lot of talk about how Johnson and Johnson is not necessarily as effective or efficacious, really, compared to Moderna and Pfizer. But if we look at a lot of the other details, it's hard for you to just make that clear distinction. Because, for example, at the time that we had Moderna and Pfizer, when the studies were going on, we had mostly, and I'm veering into other conversations now, but we had mostly one kind of coronavirus, like the COVID virus, just that one that was predominantly circulating in the US, right? But by the time we started doing Johnson and Johnson, we had more of variants around. So those studies, even though it shows like that Johnson and Johnson has a lower efficacy compared to Pfizer and Moderna, they were done at different times. And so even though you see those numbers, you can't directly draw, that straight parallel for each of them. And then with regards to just, I think regardless, getting any vaccine is better than no vaccine at all. The vaccines reduce the risk of infection across the board anyway. The more vaccinated we are as a community, the less virus is floating around, and therefore the less number of mutations that we'll get, and the less number of variants that we'll get, overall. And so there's no great benefit over, vaccine shopping, picking one over the other. I can't tell you that this one is better. There's no clear number. And even if there is a difference, rather, it's nothing significant that would make a difference one way or the other. So no, vaccine shopping is not, even though it makes intuitive sense, there's no benefit to it.
Yeah. Thank you for that directness. What do you think is the largest hurdle, the biggest hurdle to getting the entire population vaccinated? And when I say that, some people may be thinking about the US, but I know you're specifically in charge, working with and serving Ingham County.
Yeah. There are a couple of things. So there are people who want the vaccine and have been waiting for it. But we have been getting, since we started vaccinating, a certain number of vaccines every week, right? And so we are still very limited in the number of vaccines that we can administer a week, right? And so the logistics of getting that out to people, even though things have improved significantly over the last, 2-3 months in terms of volume, it's like with each month, with each week, the allocations are getting bigger for sure. And there's hope that there's going to be a lot more available subsequently. But that is one hurdle. And with time, that will get better. The other piece is hesitancy. There are people who are eligible. There are people who it is available to. I mean, if you register now at the Ingham County Health Department or at other sources, there are other places where vaccinations are happening. Pharmacies, Meijer, Kroger, CVS, Walgreens, all of those places provide opportunities. And also healthcare systems. If you, belong to any of the healthcare systems within the county, there will be a way for you to be linked or connected to a place where you can get, a vaccine. You might not happen, they might not say come in today, come and get it, but you are on a list and you will soon be able to, be connected to get it. Our health centers too, our federally qualified health centers also give out vaccines. So a lot of places are making it more available. But a lot of people are still very hesitant and saying, I've talked to people. I talked to my barber who was like, "Nuh-uh, I'm not getting it." I've talked to a lot of people who still do not feel comfortable about it. And so, like I said earlier when we started talking, information is power, knowledge is power. And so what we're trying to do, in addition to just vaccinating people as much as possible, is sharing as much information about the vaccine as we can and being targeted about it, because different people have different reasons for why they're hesitant about it. So yeah, that's
Yeah.
kind of where we are.
Yeah, and so I guess one of a question is if there is someone, me just having conversations as well with my friends, with some of my coworkers. Some people, again, are ready to have it, are ready to get it, and some people are just like really on the line, and they just want
Right.
to make a good decision. They're hesitant. Can you give them some advice? And this may seem repetitive, but can you give them some advice in terms of making the best decision that they're comfortable with? Because you can go in, you can get the shot, but you're like overwhelmed, you're full of anxiety, all these things. But if they're just really on the fence, they understand, the science, they get it's best for me, it's best for the community, but they still have very much this anxiety about it. Do you have any advice for those people?
That's kind of tough. I think that what I would say is that this is not a vaccine that is targeted at a specific group of people. We've given out a lot within, across the country. Millions of vaccines have been given out, have been administered, and we have not had any significant, outcomes that are wrong. We can also see that numbers are getting better in terms of mortality, which is really what we're sure that the vaccine does. So we know that the vaccine works and it is safe. And now, early on in December, I get it, people would have been hesitant, but we have a few more, a million more, a couple million more, 100 million more examples of the fact that it is safe. I'll give another good example of kind of like evidence as to why I'm confident to say that the vaccine does work. Right now in Michigan, I'm sure if you've been listening to the news, we're seeing that our numbers are going up again. which is kind of like our numbers are going up, and we're vaccinating people. But again, remember I said we don't have enough vaccine for everyone. And we started prioritizing by vaccinating healthcare workers, essential workers, and then people who are 65 and older. Right now, if you look at the demographics in terms of age of the people who are getting sick now, who are getting infected with COVID, it is the younger age population, right? Which is the majority of people who have not been vaccinated. That rise in number is not following age demographics too. So the 65 and older, the number of people getting sick is not increasing like the younger ones. So that means that the ones who are vaccinated are more protected, right? So that's good evidence that the vaccine is making a difference. The people who are getting infected are, society is opening up a little more, there's spring break and all of that. So we have younger people who are getting infected more, who are in the hospital, who are getting severely ill. And what we know that the vaccine does is it prevents hospitalizations, it prevents severe illness, and it prevents death. And we're not seeing that in our most vulnerable populations like we did a year ago and last summer.
Well, Dr. Shoyinka, thank you so much. I believe this conversation was very informative with science, with your experience, with what you have seen. And I also know you have a background in infectious diseases.
I do.
So it's great to have someone like you with the Ingham County Health Department as we grow through what's happening in Ingham County right now.
Right. Thank you, Cameo. And yeah, everybody stay safe out there. We still have to do all those other things, wear masks, keep, a reasonable distance, and we're going to get through it. As more people get vaccinated, I am really, really hopeful that things will get a whole lot better. Our lives are never going to be the same again, but things are going to get a whole lot better.
Yeah, I'm looking forward to it. Looking forward to it. Well, thank you so much for your time.
Thanks, Cameo. All right, take care. Bye.